Special Town Hall ambapo tunakuletea matangazo haya moja kwa moja kutoka kaunti ya Kirinyaga. Moja kwa moja nataka kuangalia tu baadhi ya jumbe ambazo zimeweza kuingia. Kuna mmoja hapa, Daktari Turanera Kagweria anauliza, na nitaisoma jinsi alivyoiandika. The county of Kirinyaga has refused to release 8 doctors to proceed for postgraduate training. We are busy discussing universal health coverage, yet there is nothing being done towards improving human resources for health. Na then ndio ni swali ambalo Daktari Agnes anaweza kulijibu kuhusiana na ni vipi ambavyo hata mnaweza kustahimili mahitaji ya hospitali wakati ambapo madaktari wanakwenda kwa masomo zaidi. Na kuna swali ambalo lilikuwa limeulizwa kuhusiana na NHIF haswa kwa walimu. Kuwa walimu ambao wameajiriwa na county wana uwezo wa kutumia kadi zao za NHIF katika hospitali za serikali, lakini wale ambao wameajiriwa na TSC hawawezi kufanya hivyo. Kwa nini? Daktari.
All right, so we will have Dr. Agnes respond to that, but please allow me to welcome on stage, because we have a new guest here, Zipporah Kasilu from Mwea Hope in Life. That is a community organization working mainly with persons living with HIV and AIDS, and we're going to be talking to you in a short while, but Dr. Agnes Gashoki, you can go ahead.
Thank you, Joe. Allow me to start with the question which had been asked earlier about the TSC teachers and the teachers employed by the county government. Those are the ECD teachers. Now, these two teachers, cadres of teachers, are employed differently. The ECD teachers are employed by the county government, so they enjoy the NHIF cover that is provided by other county government employees under the civil service scheme. But the TSC teachers have got a different scheme of insurance, and that is why they may not enjoy the same services provided by NHIF as it is for the ECD teachers. And I think the chief officer will also add a voice onto that, but that is basically the main reason, and that is the difference. If I may take the other question on the county government not allowing people to go for training, I think I may want to put it differently. It is not that the county government has refused or denied doctors to go for training. The doctors that we have in the county are about 55 to 56. Now, out of that, we have got 26 medical officers in training. And now this year, when we were posted, when the request for more doctors to go for training was posed to us, we sat down as the county executive and we realized that we couldn't afford to release more doctors to go for training for the time being. We are not saying that we are denying them to go for training, and it is not a permanent resolution that has been made by the county government. So we just requested our doctors to hold on for probably one more year, and we actually issued them with letters to take to their respective universities and colleges, so that they could be allowed to defer just by 1 year, to give us more time to be able to employ more medical officers to replace them when they go for training in the next year. That is actually the reason why we were not able to release them this year.
All right.
You can allow maybe the chief officer to add something about the...
We can come back to him later, so just so that we save time. Yes.
Alikuwa na swali kuhusiana na uhusiano kati ya county na mashirika yasiyo ya ama mashirika ya kibinafsi.
I am Meli Mochadha from our Radio of Eliud Muriithi Training College, and access being one of the pillar of universal health coverage, my question is, yes, we appreciate that the county government has been able to increase the partnership between public and private health facilities. But my question is, are there some measures or are there some plans to increase the relationship, the partnership between public and private health facilities, such that the common mwananchi will be able to access the nearest health facility? For example, in a hospital like Mwea Hospital, there is an ICU which can be utilized by a larger population in Kirinyaga County. So we are urging the government, are there some plans to increase that partnership?
Thank you, Mary. Harriet. has another question.
My name is Harriet Murugi from Our Lady of Lourdes Moya Medical Training College. My question goes to Madam CAC. According to the WHO recommendation, you're supposed to be having at least 2 facilities in 5 kilometers radius. But when you look around, there's so many cropping health clinics that are coming up, and they are not, most of them, their interest is not for the patient, but business. Are there any strategies are you putting down to regulate the upcoming medical clinics which are coming up nowadays?
Naona wengi wanatingisha vichwa, wanakubaliana na hilo swali. Labda hayo maswali mawili yanaweza kujibiwa kabla turejee huku.
All right. Madam CC, looks like all the questions are yours, but 2 questions from the students. Interesting. Partnerships with private facilities, and also the question that came from here about how do you regulate what she thinks is a mushrooming of clinics around town.
I'm glad to answer the questions, so I'm not complaining.
Yes.
Thank you for your questions, my dear students. Now, let me start with the measures that have been taken, or rather what the county government, or the government as a whole, the measures that it takes to encourage the public-private partnership. And I want to say that healthcare, or accessibility to healthcare, is not only limited to the public facilities. Accessibility to healthcare is to either private, faith-based, or public institutions. So wherever the patient, whatever facility is nearest to or the closest to the patient, they should be able to access that facility without facing financial hardship. And that is what universal healthcare is all about. So we encourage and we embrace even the partnership that we have, especially in Kirinyaga County. We have a great partnership with our faith-based organizations. Our Lady of Lourdes is one very good example. And we do a lot in a bid to help our patients actually access the healthcare. For example, the ICU facilities that is offered at Our Lady of Lourdes, it is common knowledge that we transfer a lot of our patients that require ICU care to Our Lady of Lourdes. We have a great partnership. We communicate very well. And when we need to refer a patient, even without a deposit, they are accepted at the hospital. So that is a great partnership, and we are encouraging that to continue so that we do not deny our patients health care when it is available at the hospital.
Regulating the clinics.
Now, regulating the clinic. Now, let me start by saying that if someone wants to start a private hospital or a private clinic, we assume that they have done their market survey, and they have realized that they can get, because for them it is business, whereas for the public facilities it is actually just improving accessibility to healthcare. So you cannot deny somebody the right to open a private clinic if they so wish, even if there are so many of them around them.
Okay, Zipporah, before we go to the crowd, what would you say is the place of persons living with HIV and AIDS in all these plans that you're hearing from the county government? What is the experience of the people that you speak for tonight?
Thank you, Joe. I want to thank God for this chance He has given me. People living with HIV are feeling well embraced in the Kirinyaga County because we have drugs, we have services, though we need to do more allocation on. There are some tests which are not done in the facilities where CCC are commonly, and like renal tests, liver tests, they are not available, so they have to go deeper to their pockets and they might not be able to afford. So we are feeling like we should be covered only. Not only people living with HIV, also people with chronic illness, including diabetes, pressure, and even cancer.
So they are not covered for everything, that's what you're saying?
Yes.
Okay, we'll discuss that when we come back to where we are with the universal health, but want to just get a few more questions from the floor, then we can come back this way and finish.
Jo, kulikuwa na swali ambalo lilikuwa limeulizwa pia, wengine wanahisi hali kujibiwa kuhusiana na kuwa tunaweza kuwa tunajadili swala la afya, lakini kama hatugusii swala la usafi na hata yale maji ambayo wananchi wanakunywa, basi hatutaweza kupunguza ile idadi ya watu ambao wanakuwa wagonjwa. Nadhani afisa wa kaunti kuhusiana na mazingira yuko hapa, anaweza kujibu hilo swali.
Thank you very much. My name is Jacqueline Jogu. I'm the CEC in charge of environment, water and natural resources in Kirinyaga County. I just wanted to add on top of what our Honorable Deputy Governor said, we are also doing a major project costing 1.6 billion in partnership with the national government, which will increase our water, especially in the Kirogoya and Kutus town areas, and in that will come with a component for sewer treatment, also worth around 0.4 billion shillings. So we as a county, we are very progressive, and we are going to put in basic infrastructures for treatment of water and sewerage facilities. Thank you.
Jacqueline Karanja alikuwa na swali kuhusiana na kuwa nikana kwamba sio wengi ambao wamepata habari. Ni wewe Jacqueline? Kuhusiana na NHIF.
Jacqueline Karanja from Our Lady of Lourdes Medical Training College. One of the reasons why we want to reach universal health coverage, we also want to tackle on the preventive and promotive measures. But I feel most of our insurances only tackle the curative part. No wonder you find that, like in Kirinyaga, we have diabetes and hypertension, of which we use a lot of money in the curative part. But in the preventive part, these people, the people who have the insurance, are not aware that they can also have the preventive measures catered for them. How are you going to tackle that?
Wakimobo, where are you? I hope I've pronounced your name correctly. Wakimobo, is it Wakimobo or Wakimombo? Wakimobo, that's what I'm told the pronunciation is. Are you close here? Okay, it seems he left. There's one question on this side that we can take.
Thank you. I'm Father John Kariuki, the father in charge of this place. And my question is being directed to the county government. For people to access health care, the road network must be a bit in order. This part of the country is lagging behind. I'm trying to imagine a scenario where a mother who is expectant, or they cross the Mount Kenya forest and supposed to come here, or Kirinyaga. It's very much hard.
Thank you. There's a student who had a question on Cuban doctors. Here you are.
Okay, thank you. I'm Kimathi Julius from Our Lady of Lourdes Medical Training College. Now, okay, I had an issue about Cuban doctors. These doctors, we know that they have a problem with understanding the Kiswahili language, which is the national language here in Kenya. So they need a person maybe to translate this language for them. So it means that there is a probability for these doctors to make wrong diagnosis such that the treatment they give to our patients, it is not the treatment that they require. Why should we, or why the government decide that they should bring these doctors here in Kenya, whereas we have our whole doctors who are knowledgeable, who are well-skilled, who are very qualified. Thank you.
Nadhani hayo maswali yaweze kujibiwa kwanza.
All right, Cuban doctors, curative versus preventive, and then we have the good father talking about roads, that it's not enough to just do the medical part, but there are also other things that are going on, because I want us to get close to finishing this. So as you do that, it is actually close to wrapping up. So we can start with the Deputy Governor. You've been quiet for a long time, so you must have some serious things to say.
I want to start with the preventive part that has been talked about by one of the questionnaires and say that it is in the heart of the county government, first of all, to put money where it is worth. And you have rightly said that curative is more expensive than preventive. Out of that, we've come up with a plan to increase the number of nutritionists within the county government, that we may be able to send them through our community workers to mashinani and let people understand what it means to eat and live well. So it is in the progress, and we've actually analyzed and found that it will be much easier to prevent rather than to cure. And thank you for the question. I would want to Waziri to comment on the other one.
Okay.
Maternity.
Okay. Yes, thank you for the very nice questions. Maybe I can just add one more thing about the promotive and preventive vis-a-vis curative health services. It is very true that curative health services are very expensive, and that is why the county government and the national government as a whole has realized that we must focus on preventive health services. In the county of government of Kirinyaga, for example, we have engaged our community health volunteers in a lot of community health education, whereby we conduct community dialogue days, and we have this session about promotion of good health and good sanitation. We also have a lot of health education going on in the schools. When the schools are open, we take advantage of that, and we make sure that we educate our children on promotion of good health as well as sanitation, and also screening for communicable diseases amongst the children, because we have realized that there's a lot of spread of infections like tuberculosis, and diarrheal diseases are also common in some parts of the county. So all these measures are actually geared towards preventive and promotive health care, which is one of the key pillars of universal health coverage. And on the road network, we realize that accessibility to health services is one of the key areas and actually we work in collaboration with other departments in the county government to ensure that universal health care is realized in all areas. So departments like the road, public works, agriculture department, environment and sanitation, they are our key collaborating departments, because we know that you cannot get to the nearest facility if the road network is poor. So we are working in collaboration with them further so that we can ensure that our mothers get to the health facilities when they need emergency care, for example, delivery, they need to access the health facilities in good time, even for their lives to be saved. So that is one of the things that we are working.
The Cuban doctors.
The Cuban doctors.
Do they speak Kikuyu now?
Some, yes, they do. They have learned Kikuyu even. We were lucky. One of the counties that was lucky to receive, one of them actually is very fluent in English. She has learned a bit of Kikuyu. And I can say that we learn something from everybody. Cuba is one of the countries that has realized very, very low maternal mortality rates. Actually, zero maternal mortality rates. And I'm sure that we are learning a lot from the Cuban doctors. So, for example, they have a very good system of community engagement. And they are teaching us on ways of how to engage the community, how to reach out into the community, and even our doctors are now learning to go into the community, to educate them, and even provide health care in the households. So we are learning something from them, and we can't say that it was a bad investment for the government to invest in the Cuban doctors, because everything small you learn in life is a step in the right direction. And I believe we learn something from everyone that you come across in this life.
Eliud, let me ask you, you mentioned earlier that you don't have too many problems with how you work with this county government. So when you have a county like that, what are you doing now Is it everything is okay, kumbaya, hallelujah, or what is it that needs to work better? Surely there has to be something that needs to be improved.
Joe, I must admit, world over, our health supply chain has not been very easy. And I want to tell you that all is not very well, and we have to do certain things to ensure that we achieve what we plan to achieve for our citizens. So in this particular county, we've sat down with the leadership, and we have realized that strengthening of healthcare supply chain is a must. So we have come up with a package of training with the Ministry of Health on commodities management and data management. And we have scheduled a training for the health workers within Kirinyaga, and especially so the health workers who are mandated to manage may it be pharmacy, may it be non-funds, may it be reproductive health, whichever commodity is. So we'll be sitting down with about 50 health workers to train them on how to manage effectively commodities and how to report. And we are working very closely with other entities to come up with a system that will be acceptable to all Kenyans, and especially so to all health facilities in terms of reporting. So having said that, I thank the CS, or rather the CEC of Health in Kirinyaga, for having mentioned that they are taking steps towards promotive, preventive, over and above the curative aspects and rehabilitative. So we are working with them to identify those commodities that will meet their needs in terms of, say, preventive, say, public health chemicals. So we identify what are these public health chemicals they require to be able to address issues to do with contamination and all that.
Okay, we'll go back to the floor for one or two more questions.
Naam, nadhani hili swali litakwenda kwa KEMSA. Jeremiah Nyaga.
My name is Jeremiah Nyaga, and I come from Mwea. I want to address my question to KEMSA, Kenya Medical Supplies Authority. I understand one of your mandates is to help county governments to establish and maintain appropriate supply chain systems for drugs and other medical supplies. We have been seeing a scenario where some of the counties are experiencing delays in supply of medicines even after procuring the same within the required timelines. And Kirinyaga is no exception. What are you doing as an organization to make sure the supply of medicines and other medical equipments arrive in the counties in real time to work in tandem with the demands of the same in our hospitals?
Beverlyn Kareidi, nadhani tutamaliza na wewe.
I am Beverlyn Kareidi from Kabare. My question is, of the recent past, we saw the story of baby George go viral, and afterwards we had 3 cases in Kirinyaga of asthma. So what is the county government willing to do about the condition? Eczema.
I didn't get that.
Dr.
Okay,
Mushoki.
the CEC didn't hear
Okay,
much
she's
about
asking the question
baby.
about baby George. A video of him scratching himself because he had eczema went viral a few months ago, and the county government stepped in. But there have been more cases of eczema in this county. How is the county handling that issue?
Okay. So we are about to wind up the show. So what we are going to do as we answer the questions, we are also going to be wrapping up. So I'll start with you, Zipporah. You have been listening to all of these things. You work with communities, specifically with the persons living with HIV and AIDS. When you hear this conversation about universal health coverage, because we are rolling it out, at least the plan says by 2022. So what is that thing that you would like to see as someone who represents that category of people when this conversation is going on?
I want to thank God for this chance because I've heard Daktari akisema that they are doing something
And
to
you can
do.
speak in Kiswahili.
Yeah, they are doing something good on CHVs, which will do marvelous in the community because of prevention. And I also want to urge Daktari also to look into OVC program, cash transfer, which is in the program, but it is not covering the whole the people who need. We also request for, in order to cover the first 90, the government, the Kirinyaga County, to do something on HIV testing, because you know that partners are supporting counselors, and we thank God we have self-testing kits in the county, but we also need some counselors who are supposed to go in the community and do the HIV testing, so that we may get more, we identify more in the county, so that we may reduce the HIV infection in the county.
All right, but I'm already closing thoughts.
Oh, thank you. Joe, I must say that the success of UHC is not an option for us. We are very lucky we have a winning team at the Ministry of Health, led by the CS, the CAS, the PS, and other senior officers from the Ministry of Health. We've had meetings to ensure that preparations are on top gear. And I can tell you for sure that we are ready and willing to supply affordable, quality health commodities to Kenyans. And I want to assure Kenyans that we have worked with the ministry and, of course, the counties to come up with a list of the commodities that are required to ensure that UHC becomes a success. We have identified strategic partners that we have already thought through what needs to be done to ensure that the commodities that are coming from strategic partners are availed in good time. We have identified primary health care as one of the avenues to ensure that we achieve universal health coverage. We have identified diagnostic equipments that are required at that level, commodities required at that particular level. So I want to tell you, Kirinyaga citizens, that very soon in your dispensaries, in your health centers, your health care needs will be met. Okay, and it will be met through the partnerships between your county governments, KEMSA, and the Ministry of Health. And having said that, I know there are still challenges. Those challenges will be surmounted because the government is working in unison. And I must admit that the President instructed all the enabling ministries that are supporting the Ministry of Health to sit down and then identify that which needs to be done to ensure that universal health coverage is a success. And I want to confirm that those deliberations have been documented. The President has been briefed on the arrangements that have been arrived, and you'll be seeing changes very, very soon.
All right, all right. Thank you, Madam Muriithi. Yes, I think we should come to you, Madam, to answer the question of eczema. How serious is that problem in the county? And then finish.
Let me start by saying that eczema is a very common condition. It is not actually an illness. We call it a condition. And it is very common, probably in every other family you'll find somebody with eczema. But if it is not treated in good time, it gets into severe situations where you even get infections superimposed. So we want to say that, yes, when the case of baby George came up, we asked the mother, we actually brought the mother to the hospital, and the child was treated at our county referral hospital. And we realized that it was just that it had been neglected, and it had gotten infected, and that is why it was looking so bad. So if eczema is managed in good time and early enough, it is actually a condition that can be put under control.
All right, okay.
So that is a common problem, but it's not a major problem.
All right, all right.
And if I may just say, probably, as I wind up on universal health coverage, I want to reiterate the fact that the county government of Kirinyaga is very serious about universal health coverage. We have taken that aspect of the Big Four agenda from His Excellency the President very seriously, and we are actually handling all the components of universal health care to make sure that we meet all the three major objectives of universal health coverage, including improving our diagnostic services. You know that we have now installed a CT scan machine at Kirinyaga County Referral Hospital, which is going to help us in offering diagnostic services. And also, improving our bed capacity from the county has got about 539 bed capacity currently. We are going to improve that to a minimum of about 900 beds in the whole county, which is a major step in making sure that everybody, everywhere, can access health services. And of course, we shall be coming up with the ways of healthcare financing to ensure that everybody is accessing the health services without facing any financial hardship.
All right.
And that is our commitment.
Thank you, Madam Deputy Governor.
Well,
please do just 30 seconds so that we finish.
30 seconds. First of all, I want to bring greetings from My Excellency the Governor Anne Waiguru. Mmezipokea? Now, but the last one I want to say, just as Waziri has said, it is within the heart of the Kirinyaga County Government to ensure that every citizen coming from whichever quarter is able to access health care. And that is why we have put resources towards it, and also in line with the Big Four, that is healthcare, universal healthcare from Excellency the President. It is within our hearts that every member, either rich or poor, will go to any hospital and access good healthcare. And whoever accesses it does not mean that the person will remain or will be strained by the finances. And this is the spirit of the universal health coverage.
Thank you very much.
Thank you. It's getting sweeter as we go on.
I noticed that, and it's getting late as we go on. So thank you very much. Let's end it there. My name is Joe Ageyo. This has been Monday Special, Citizen Monday Special Town Hall that was coming to you live from County number 20, Kirinyaga County. And I've been with my colleague who is somewhere in the crowd, Mashirima.
Namjo, bila shaka, this has been an amazing audience. Thank you for your questions. Mmejibamba? Mumeuliza maswali mengi? Sawa sawa. So you have to keep it Citizen TV so that you will be able to know where we'll be headed next week. Naitwa Mashirima Kapombe. Usiku mwema.